Hello to the all of audience. In this next occasion, we are from SGD number B1, would like to present our student project entitled Neuroleptic Malignant Syndrome. But before moving forward to the next presentation, let me introduce our members of group which is shown in the slide. For the next speakers, the time is yours.
Good morning, doctor and friends. My name is Nadia with my last digit number 160, and I will explain chapter 1 of this paper. So the first one will be introduction. So dopamine receptor antagonists, or DRA, also known as the first generation antipsychotics such as phenothiazines and butyrophenones, could induce a potentially fatal disease known as neuroleptic malignant syndrome when someone did a sudden stop of dopaminergic treatments. So mental status change, fever, muscle rigidity, and autonomic instability are examples of these classic clinical features. NMS is considered a rare disease by Ginnard, therefore, a controlled long-term studies focusing on this disease are extremely challenging because of its uncommon occurrence. The problem formula for this paper would be how to state the diagnosis and the urgency to know neuroleptic malignant syndrome. The second one would be what are neuroleptic malignant syndrome managements and treatments in order to reduce the complication. And the last one would be what are the differential diagnosis and future strategy to overcome this disease. So the objective from this paper will be divided into two, general and specific. For the general one is to know more and further about neuroleptic malignant syndrome, therefore increasing understanding and knowledge on this rare disease. And the specific one will be to know how to diagnose and the urgency of this disease, to know about the treatment and treating of this disease, and to know the neuroleptic malignant syndrome is often associated or commonly diagnosed as, and how to overcome this disease and the future strategy. So for the benefits of this paper will be gaining knowledge about neuroleptic malignant syndrome and why it is important for writers to know with hopes for expanding our scientific knowledge. Okay, so that's from me. The next one will be continued by my friend. Thank you.
Hello everyone, my name is Rafadiar Rafadri with my last three digits of my student number is 244. So the first one is definition. Neuroleptic malignant syndrome is a life-threatening condition associated with medication that block dopamine receptors or the abrupt cessation of dopaminergic drugs. It's more common with typical antipsychotics like haloperidol and fluphenazine and is characterized by mental state change, high body temperature, muscle stiffness, and autonomic system instability. Although rare, early identification and treatment are crucial to prevent serious harm or death. Treatment involve discontinuing the problematic medication, providing intensive supportive care, and using medication like bromocriptine mesylate and dantrolene sodium for severe cases. If neuroleptic malignant syndrome results from stopping dopaminergic medication, reintroducing it promptly may help alleviate symptoms. That's all from me, continued by my partner.
My name is Aryan Arnas with last digit number of student ID is 002. I will explain about the epidemiology of neuroleptic malignant syndrome. This syndrome occurs between 0.01% until 3.2% of those who are being given neuroleptic medication. The number of cases has reduced to the advent of new drugs that are less likely to produce NMS, and the public awareness of the disorder has grown. The majority of these cases occur in young adults. However, this is most likely caused by to age at first neuroleptic medication exposure rather than age-related risk. Men outnumber women by a factor of 2 when it comes to this syndrome. This is linked to the likelihood of being exposed to the causal substance. Based on the likelihood of the exposure of the triggering factor, incidents caused by the withdrawal of dopaminergic medicines are more likely to occur in the geriatric population. That's all from me. Thank you.
Hello, my name is Kamala Sri Bunga Sudani with the last three digit of student number is 241. I will explain about the pathophysiology of the neuroleptic malignant syndrome. A neuroleptic malignant syndrome, or NMS, is an idiosyncratic reaction to the antipsychotic drugs that can occur in the patients with initial or prolonged use. NMS can be caused by a sudden dose change that are either too high or too low. This idiosyncratic reaction can be very dangerous as it is not a consequence of the known pharmacological and allergic status of the patient. However, this reaction is an abnormal response to a typical normal dose that is unpredictable due to various factors.
Thank you. My name is Sigede Pramaditya Wahyu Saputra and the last three digits of my pseudo numbers are 045. In this occasion, I would like to continue the presentations of my friend about the pathophysiology of neuroleptic malignant syndrome or NMS. The pathophysiology of NMS is not well understood, but it is known to be associated with the blockage of dopamine receptors due to the use of antipsychotic drugs, but can also be caused by antiemetics. It is also known that NMS is not only caused by the blockage of dopamine receptors, but it also often happens in patients with the withdrawal use of dopaminergic agent. The blockade of D2 receptors within the nigrostriatal, hypothalamic, mesolimbic, and mesocortical pathways have the pivotal role of the symptoms of NMS to appear. It is believed that the drop of dopamine level in the hypothalamus causes hyperthermia in NMS. It is also known that mental status changes in patients with NMS are associated with the decreased level of dopamine and the dysfunctions of mesocortical and mesolimbic pathways, and the less activity of dopamine in nigrostriatal pathways could be the reason why patients with NMS have muscle rigidity. That's all from me, and the presentation will be continued by my friend. Thank you.
Dopamine has a role in regulating renal electrolyte homeostasis. This dopaminergic system regulates fluid electrolyte balance through the hormone system, such as renal renin-angiotensin or RAS and vasopressin. Increased renal RAS stimulation leads to decreased sodium reabsorption due to a stimulated renal dopaminergic system. Hypertensive events themselves are associated with a hypoactive renal dopaminergic system, which increase sodium reabsorption. Therefore, dopamine may affect serum osmolarity and blood viscosity and is believed to be a mediating factor in the incidence of NMS and its relation to a water electrolyte homeostasis. Serum osmolarity mainly depends on the content of serum concentration of sodium, glucose, and urea, with its important role to the distribution of water throughout the body. This regulation of osmolarity will affect the fluid electrolyte imbalance. The impact of the body can lead to an increased risk of the heart disease, respiratory disease, renal impairment, brain, and even mortality.
Okay, thank you for the opportunity. My name is Yuda, and I will explain about the risk factors of NMS. Basically, escalation of neuroleptic pharmacotherapy take the main role of risk factors of NMS. The heightened potency and prolonged duration of action exhibited by neuromuscular dipole formulations are associated with the highest potential of adverse effect. NMS also happens due to the risk factors of sudden alteration of pharmacotherapy. Sudden discontinuation of dopaminergic agents, recent or rapid dose escalation, and transitioning from the one therapeutic agents to the another take a part in NMS. Besides of those risk factors, certain medical conditions such as iron deficiency, weariness, dehydration, agitation, Parkinson's disease, hyperthyroidism, alcoholism, catatonia, and organic brain syndrome or prior brain injury also be risk factors of NMS. Several additional risk factors have been documented in the literature, including but not limited to the advanced age, the presence of comorbid medical condition, mental retardation, and history of neuroleptic malignant syndrome, and a personal and or a family history of catatonia. That's all from me. For next speakers, the time is yours.
Hello, my name is Nyoman Gediwil Gunatri Paramanta and my last three-digit number is 180. And I'm going to explain about the clinical signs, tasks, and diagnosis of neuroleptic malignant syndrome. Neuroleptic malignant syndrome, or NMS, often presents with a variety of clinical signs and symptoms such as fever, tremor, altered consciousness, severe muscle rigidity, and serotonin phosphokinase elevation that lasts up to 10 days. NMS is diagnosed based on a set of clinical criteria, and all of these criteria are required for diagnosis. The most commonly used diagnostic criteria are the ICD-10, DSM-4, and DSM-5 criteria. According to DSM-5, neuroleptic malignant syndrome's diagnosis requires the exposure to antipsychotic medication or other dopamine blocking agents. severe muscle rigidity and elevated temperature or hyperthermia, autonomic dysregulation such as tachycardia or rapid heart rate, labile blood pressure, and diaphoresis or excessive sweating. Laboratory tests are crucial for confirming the diagnosis and ruling out other potential causes of similar symptoms. These tests may include serotonin kinase levels, complete blood count, electrolyte levels, and liver function tests. So that's all for the clinical signs, tests, and diagnosis of neuroleptic Malignant syndrome. Thank you.
I am Gusti Agung Krisania Maputri with the last three digits of my student number R143 will explain briefly about complications of neuroleptic malignant syndrome. Early detections and intensive treatment in most neuroleptic malignant syndrome help the patients to get a faster recovery rate and decrease their mortality rate by up to 10%. Even if early mortality reports for NMS were more than 30%, most of their early detected patients can completely recover in 2 to 14 days. Patients who have recovered also need to be monitored and avoid dehydrations in order to control any symptoms of recurrent neuroleptic malignant syndrome. NMS symptoms such as fever, muscle stiffness, and autonomic instability can get worse in unfavorable conditions like unawareness, delayed detections, or ineffective treatment. These conditions make the patient has higher risk of significant morbidity. NMS can lead to developing catatonia, vascular rigidity, severe hyperthermia, cardiopulmonary and renal alterations or complications, and Parkinsonism. Fatal NMS may also lead to mortality that commonly due to respiratory failure, cardiac arrhythmias, renal failure, or disseminated intravascular coagulations. And more importantly, older age patient has a higher mortality risk. That's all for me. Thank you.
Hello everyone, my name is Sasi Kirana with Trila student number 087, and now I would like to explain about treatment and management of neuroleptic malignant syndrome. Most cases of neuroleptic malignant syndrome or NMS occur following the use of antipsychotics medication. Therefore, the initial step in managing NMS is discontinuing the use of antipsychotics. After that, supportive therapy should be provided to the patient. Most antipyretics are ineffective in reducing fever in this case. Therefore, lowering the patient body temperature should be done mechanically by using cooling blankets and applying the ice packs to the patient groin and armpits. In patients experiencing muscle rigidity resulting immobilization, intravenous fluids may be administered. The aim is to prevent dehydration and kidney failure due to increased myoglobin levels in the serum. Additionally, respiratory difficulty may occur due to increased oxygen demands and muscle rigidity in the chest wall. Therefore, the patient requires intubation and ventilator support to assist the breathing. That's all from me. Thank you.
Hello, my name is Maria, and I'll talk about pharmacology treatments to cure NMS when it gets severe enough. The first option is to use dopamine agonists such as bromocriptine, amantadine, and levodopa. These drugs is believed to be effective against NMS. It can be followed by the using of antipsychotics if it's needed. The second option is datrulene, which is a muscle relaxant. It can be administered via intravenous path. This medication, however, is hepatotoxic, so if the NMS was cured, might as well to stop consuming this particular drug. That's all from me. Thank you.
Okay, so my name is Farza Husnadipa with real life digit of student number 102. So I'm going to explain about the differential diagnosis of neuroleptic malignant syndrome or NMS. So the first one was serotonin syndrome. So it is induced by the use of antidepressant drug, especially serotonergic, and it has similar clinical features with NMS such as altered mental state and then autonomic dysfunction. So to differentiate between them, the serotonin one was more associates with serotonergic drugs rather than antipsychotic drug, and it has rapid onset and progressions than the NMS, and it is characterized by clonus and hyperreflexia. Meanwhile, the NMS one was hyperreflexia, and the second one was malignant catatonia. It is one of the subtype of catatonia or mood and motor disturbance. So according to the DSM-5, it has to at least fit 3 criteria of catatonia and had to be also autonomic dysfunctions to be diagnosed. And it is more associated with depressions and psychosis rather than the use of antipsychosis drug. antipsychotic drug. And the third one was malignant hyperthermia. So it is a genetic disorder that target your skeletal muscle. It is caused by the inhalations of halogenated anesthetic substance, and it is rare and life-threatening, and it is susceptible to people who keen to heat exposure and people who like to exercise, and it also has similar clinical features with NMS. The giver, it is more like an anesthetic emergency rather than drug related syndrome. And the last one was other drug induced disorder and medical conditions. So the drug related one was intrathecal baclofen therapy with DRAW, which is a therapy that used to treat muscle sore by relaxing them. The second one was central anticholinergic syndrome, which is an intentional or unintentional drug overdose. And the third one was acute intoxications of ecstasy and cocaine, something like that. And the last one was medical conditions. It is associated with meningitis, encephalitis, pneumonia, sepsis, and acute hydrocephalus. So they all exhibit like similar clinical features with NMS. So they are the different diagnosis of neuroleptic malignant syndrome. That's all from me. Thank you. Next.
Hello, my name is Janarka Pramesti with the last three digits of the number 208. So now I'm going to tell about the conclusion and also the recommendation of our student projects. So neuroleptic malignant syndrome is a life-threatening condition because of the use of medication that block dopamine receptor. And most likely caused by age at first neuroleptic medication exposure. The pathophysiology of NMS is associated with the blockage of dopamine receptor due to use of antipsychotic drug. Number of medical condition can increase the chance of a certain outcome of NMS, fever, tremor, severe muscle rigidity that lasts up to 10 days are the symptoms of NMS. The management of NMS is discontinuing the use of suspected causative drugs, also need supportive therapy. NMS can lead to cardiopulmonary alteration or renal complication, hyperthermia, and Parkinsonism. Differential diagnosis of NMS consists of serotonin syndrome, malignant catatonia, malignant hyperthermia, other syndromes that are also induced by drug and other medical condition or disorder. After reading the student project, we recommend that the reader expand the research to include a more extensive topic about neuroleptic malignant syndrome to understand the student project. That's all from me. Thank you.
Okay, that's all from our student project presentation, and we would like to apologize if there are any mistakes in our student project presentation. And thank you for your attention.